We need to act it today. We cannot wait for tomorrow.
Nobody can do this alone. Early action saves lives. Empowering our women is also a way forward.
Zero dose children should be a priority.
If we work together across boundaries, we know we could eliminate this cancer.
Getting zero is very possible.
Hello and welcome to Getting to Zero, a conversation series from Sabin Vaccine Institute with global public health leaders about how we can get to zero preventable deaths through preventive measures like vaccinations. If you would like to receive updates about our series, please like and subscribe below. I am your host, Dr. Sangwe Clovis, a public health physician and researcher. In 2023, I won the Sabin Rising Star Award for my efforts as the founder of Rural Doctors in Cameroon, where I researched new ways to reach zero-dose children in fragile settings. I'm excited that today I will be interviewing Dr. Paul Ngwakum. He is the Regional Health Advisor for UNICEF's Eastern and Southern African region. Dr. Paul provides technical and strategic guidance to UNICEF country offices. We're counting about 21 country offices in Eastern and Southern Africa, where we have almost about 51 million children at different phases of public health challenges, and of course, lots to celebrate, but really varying difficulties across issues like HIV, conflict, increasing outbreaks, deadly diseases, and so on. And Dr. Paul Ngwakum brings today over 30 years of work experience, especially related to maternal and child health, and not just working in the global health sector, but also in the humanitarian sector across difficult, hard-to-reach settings, including countries like Mali, Burkina Faso, Chad, and Haiti. Dr. Paul, thank you for joining me today. You're welcome.
Thank you very much, Dr. Clovis. I think I will want to commend you and your team of rural doctors for the enormous results you've been able to contribute to public health. I also want to recognize and congratulate you for your leadership.
Thank you so much. So to start, over the years, we've achieved quite a lot globally and also as a continent, Africa, when it comes to immunization coverage. However, you agree with me that we've still witnessed repeated and if not increase in outbreaks across different diseases, including vaccine preventable diseases like measles. So I'm just curious to know from your experience and the work you currently do at UNICEF, what will you say are the main drivers of these increases and what can be done to reverse this?
This is a very, very important question, and I think it's a troubling situation that we are witnessing increasing in outbreaks, cholera and other vaccine preventable disease outbreaks. And this is due to multiple overlapping drivers. The first one, which I think everybody will agree with us, is the disruption of services due to the COVID-19 pandemic. Health facilities were closed, children were not adequately vaccinated or not even vaccinated at all, and we had this big immunity gap with huge numbers of zero-dose children. So that's number one driver. The second driver is linked to our weak systems leading to low coverage in vaccination because of insufficient financing, for example, insufficient planning, insufficient human resources, and also increasing the immunity gap. We have other issues, urbanization and people coming to live in urban slums with poor sanitary conditions leading to diseases like typhoid or even cholera. But climate change is also a big driver, right? We are having changing weather patterns, droughts, floods, cyclones disrupting the ecosystem and putting populations in precarious situations. But above all, on the continent, we are having lots of conflicts, wars, internal conflicts, leading to displacement of populations, and all this puts them in precarious situations and pushing the increase in these outbreaks.
I totally agree. Thank you so much for that in-depth overview of what has been a clear picture across the continent. I think the question that most experts and everyone else with interest in public health will pose now has to do with the best approaches now to optimize preventive care, especially when it comes to immunization. As you've clearly stated, you have countries experiencing completely different, challenges, be it crisis, be it the after effect of the COVID-19, repeated outbreaks of other diseases that tend to impede even the uptake of those immunization services. So from your years of experience so far and some of the work that you're currently doing, what will you suggest or recommend as the best way to approach optimizing services like immunization within, this given complicated context that we are currently in?
That's a very, very interesting follow-up question, Dr. Clovis. The first advice I'm going to give is we have to invest in primary health care. We have to ensure that we have strong systems, strong community systems, so that we have enabling environment to be able to intervene when we have climate challenges and avert erosion of the gains that we've accumulated over the years. That's number one. Number two, we have to be intentional about immunization and make sure that we really ensure that we know where these children that have not been vaccinated are, and we take the vaccines to them. The third point is we are working with communities. We have to engage these communities. They have to participate, and they have to be part of the decision-making process on how they want to receive these services. And I think we have to use data and innovation to make sure that we know where these children are so that we know exactly how to plan to be able to reach them. Those are some of the few strategies that we can use to be able to increase uptake of immunization, especially on the African continent.
Wow, thank you so much, Dr. Paul. I think these are very good responses, some of which we've witnessed directly in the field, how, if you are able to integrate services when approaching communities, the uptake automatically increases because the communities face you with, a more receptive view because they believe that you understand what their challenges are. And you're not just coming in to, just vaccinate and leave. And that brings me to a question which we had once conducted. There is a study that I did lead in Cameroon that was focused on using integrated services to generate demand. And I know in the past almost 30 years or so, you've been involved with nutrition. And not just nutrition, but combining nutrition with other types of preventive health services, including immunization. I know of the HPV plus and other form of integration that is currently being practiced. So will you consider this to be the way forward, looking at integrating immunization with nutrition or, other primary healthcare services, as you've mentioned, even when we are talking about campaign approaches or outbreak responses and things like that?
Absolutely. That is the right thing to do. When you integrate services, you increase acceptance by the population. When a caregiver brings the child for immunization, for example, at the same time, that child is weighed. That child is screened for malnutrition. That child receives vitamin A. It's more efficient, and it encourages this caregiver to come back because it's an opportunity that you use to be able to give integrated services, which the child needs. And I think even in terms of profiting from the opportunities, these children, they're almost always of the same age group, less than 5 years old. And if the child makes his or her way to your caregiving center, I think it's logical to be able to profit to give this package.
Yeah, thank you. Thank you so much. I totally agree. However, what we face or what the continent faces has to do, there are a couple of things. You have issues around capacity to even do this integration in the first place. And there are many others which you may have witnessed while coordinating some of these processes. So I'm really curious to know, and I'm sure a lot of audience will really be interested to understand some of the challenges that they can anticipate in, integrating this kind of services. I think across different programs, sometimes there is resistance in moving away from vertical programs because of the fear that, integrating one program with the other will lead to a drop in performance of the other program. Also, factors like that. So just curious how this actually plays out in the field. Are there real challenges that we should be looking out for?
There are challenges, but these challenges are not insurmountable. The first challenge you're going to meet with issues linked to integrating services is the fragmented setup of these services themselves. If you go to the ministry, for example, you have a different unit dealing with immunization. You have a different unit dealing with nutrition. They have different reporting lines and even different funding sources. And it becomes difficult to bring them together. That's number one challenge in integrating services. The second one is you have to think about the human resources that are also delivering these services themselves. Because a nurse that is trained and has capacity to be able to do immunization, when you increase other services, for example, nutrition services, you have to build their capacity and you have to give them the tools to be able to not only deliver but monitor and document this. Another challenge, just to add one more, is the supply chain. Immunization and, for example, nutrition, they have two different supply chain systems. One needs cold chain, another one may not need cold chain, but has a different distribution system. We have to think on how to harmonize and make sure that we plan in a holistic way to be able to have these supplies so that we can easily deliver. I don't want to maybe cut you short, but I think the conversations on the continent is in the direction of ensuring that we deliver holistically. I'm thinking about conversations around the Lusaka agenda on how we can better manage our different partnerships, bringing government, bringing other stakeholders, bringing the global health initiatives or donors around the table to be able to support the national health strategic plans. Having one plan, one implementation, one monitoring framework is going to facilitate and is going to reduce these risks of fragmentation and not being able to deliver the services to the child in a holistic way.
Absolutely. I think talking about the Lusaka agenda and the current continental, drive towards the Africa that we want, I would like us to talk briefly about the current funding landscape, which is currently very complicated. Integration, especially at the early onset, requires a lot of investment, planning, capacity building, until it gets to a point where we're able to level up. Now, my question is, with the current funding landscape, what will you think should be the drive in the continent to ensure that we're able to sustain this kind of integrated services?
Well, I think the global challenges that we are having in healthcare financing is an opportunity for Africa to rethink the way we design our interventions and the way we fund these interventions in general. It's an opportunity to be able to think on how we can generate resources on the continent, within the countries in the continent, and use those resources efficiently to be able to deliver basic social services for the children, for the continent in general. And I think this is an opportunity to be able to think about how to integrate services, how to deliver immunization, how to deliver nutrition, how to deliver other services using the primary healthcare platform, which is integrated. That's number one. The second one is talking to governments and talking to the different ministries in the different countries I visit. They are not thinking about innovative financing, actually. How do they increase fiscal space? And you hear things like health insurance. You hear things like targeted resource mobilization or targeted taxation, taxes for beverages, sugar, taxes for alcohol, taxes for tobacco, that can be used to be able to increase fiscal space for delivering of integrated services. And also partnerships with the private sector. This is another opportunity also. So I think it's an opportunity for us to be able to think on how can Africa be able to kind of finance the health systems on the continent. And I guess as time goes on, we'll be able to come out of this crisis better than before.
Wow, thank you. Thank you so much for this simplified answer, which I would imagine in practice is a lot more complicated and requires lots of commitment from everyone. But this is very insightful. Just to part ways with one more question. I'm aware that you are working on an autobiography. It's called A Journey of Hope. And it tells your story of how you became a doctor, your motivation, and what you've done at this level as a global health leader, and how you've been able to tie your current job to your experiences growing up, in a small village, Bamunkumbit in Cameroon. So I'm really curious, not for you to let the cat out of the bag before the publication, but looking at the current Africa's public health development today, the current landscape, where should we actually be persevering? Do you see hope based on your experiences, and where exactly should we be persevering? Thank you.
Thank you. Thank you, Dr. Clovis. Now, as you say, this conversation is not about a book launch, but I'm going to kind of, the journey of hope for me is a very personal story. And it should be your story also. For me, the journey of hope is the story of every African child that dares to dream boldly and that dares to work hard to be able to change their life trajectory. And I just want to profit to say hope is a spirit. It's perseverance, it's sacrifice, it's hard work. And talking about the journey of hope, for me, it's not about optimism. It's not about the belief that tomorrow will be better. No. It's about the deliberate actions that we take to be able to change the trajectory of our lives, change the trajectory of our communities. And a community health worker that ensures that the community is informed, behaviors are changed, and they adhere to immunization, for me, that is the journey of hope. A vaccinator that vaccinates the child, not the tally sheet. That is concrete action to be able to change the trajectory of our continent. That's the journey of hope. And the same story goes for young doctors. If you're a young doctor, or if you're a doctor, you have to be able to offer patient-centered care, be it in the dispensary, in the health center, or in the hospital. And same goes for governments. I think it's now more than 2 decades when we gathered in Abuja and we talked about 15% of government budgets allocated for healthcare delivery. I was just looking the other day at the statistics again. We are on an average of 7%. That is not a journey of hope. But the good thing is, looking at the continent, all expectations are leaning towards the journey of hope. Be it the leaders, be it young people like yourself, we are working on improving the continent. And as I said, it's not by believing that tomorrow will be better. It's by intentional investment in that change that is going to make our continent better, that is going to make access to basic social services closer to the population, that's going to contribute to be able to reduce under 5 and maternal mortality. And that's going to contribute to take us towards the different targets that have been set, be it the SDG targets or the Agenda 2063, which you rightly said, the Africa we want. That is the journey of hope.
Brilliant. Thank you so much. It's been amazing having this conversation with you. Thank you.
Thank you very much. It was my pleasure.